If you're an athlete who's injured, Faith Regional has a team of physical therapists who can help you get back to exercise. Let's meet one of them. I'm joined now by Russ Baumert, a physical therapist with Faith Regional Health Services, and we're talking specifically about physical therapy for athletes. What are some of the injuries that you're able to treat?
Well, we treat all post-operative athletic injuries as well as acute and chronic injuries that athletes can develop.
What are some of the primary exercises or practices that you'll run athletes through during physical therapy sessions?
Well, a lot of athletes that we see, the two big injury areas that we see are shoulders and knees. And so a lot of rehabilitation to athletes comes into those two body parts. It's not to say that your neck or spine, ankle or hip or any other place can't be injured, but we see a lot of knees and shoulders.
Now, one of the most dreaded injuries is an ACL injury, and female athletes are more likely to experience those in a non-contact setting. Why is that?
A couple of factors. Some of the two main factors that a physical therapist can address is strength in certain parts of their leg and then jumping technique. And so there are programs out there that can address both the strength and the technique of jumping.
Sportsmetrics is one of those programs, and you brought it with you to Faith Regional. What does it seek to address, and why does it work?
Sportsmetrics is a program that the hospital currently puts on to area athletes. It's specifically targeting female athletes and trying to decrease the risk of that non-contact ACL injury.
What have you heard in terms of feedback from athletes, parents, and the community coaches about how a program like this can give them confidence in the health of their athlete?
Well, in Sportsmetrics, for example, there is a pre-test and a post-test. So athletes can see immediately their improvement of their jumping mechanics or their strength. From a parent standpoint, parents are always looking to try to keep their kids healthy at an individual level or a team level. I mean, this is something that is real, it's backed by evidence, it's effective.
Russ, thank you so much for lending your expertise.
Thank you for having me.